So, hi, everyone. I'm Dr. Anita Wong, and I'm a board certified emergency medicine physician and fellow in anti aging metabolic functional medicine. I'm practicing preventative medicine, preventative aesthetics, focusing on resilient system, restoring energy, better intimacy, a stronger core, anti leakings, and anti sagging. This is all to improve quality of life with optimal health and vitality to the very end, right? So, I wanted to talk about pelvic pain. I know men can have pelvic pain too. Not as common as women, but men's it would be prostatitis, maybe constipation, irritable bowel, bladder disorders, uh, uh, issues like this, or kidney problems. Same with women. But and women can have fibroids more common when they grow larger, they get more disruptive, or we have PID, an infection in the pelvic area, ovarian cyst, ovarian remnant syndromes from leftover surgery, miscarriages, all pubescent females experiences menstrual cramps because that's the muscles contracting. But what I really wanted to focus on today was women suffering from endometriosis. You know, and you're not alone. There's estimated over 176 million women suffering, and it's one of the leading causes of infertility. So, if you don't know what endometriosis is, it's the lining of the uterus. So when it's preparing for that baby, you're building up the blood supply, and the lining gets thickened, and the uterus grows and thickens, and then when the egg, if it's not fertilized, the lining is not needed, and the lining is shedded, and that's what we call menstruation. Um, Now, what occurs sometimes is that the tissue that's inside the uterus, it just somehow finds its way in other areas of the body. So it could be in the abdominal wall, it can be in the fallopian tubes and over. It kind of migrates everywhere. So you have this living, breathing tissue, and it's doing the same thing. It's cycling. So the hormones make it build up, and then it needs to release, but it can't release. It can't go anywhere. It can't shed. So it causes inflammation. It's trapped. So when it's trapped, it's causing this inflammation. It causes pain, scarring. It can attach to other organs, and they can attach to each other, get stuck together, and just cause severe pain. So you just have painful periods. The conventional treatment is hormone treatments, steroid treatments, and surgery, removal, hysterectomy. So if you're young in the reproductive years and you don't want to have surgery, you want to have a family, and this is causing infertility. And then when you have these abnormal tissues, it can be disruptive to the cells and can be grow into cancer. So, but there are some endometriosis that are just kind of silent. They just kind of just insidious and slow, and you don't really have any symptoms. You don't know it, but you have infertility. So, but more commonly, it's going to be painful periods, irregular periods, painful intercourse, increased pain during bowel movements, increased pain during urination, as you may have the tissue around these areas, excessive bleeding, more than usual, spotting, bleeding between cycles, painful digestion, constipation, nausea, chronic lower back and lower abdominal pain, the pelvic pain, the infertility, as I said, and you can have even joint pains, nerve pains, chronic fatigue, bloating, right? So if you don't want to go the conventional route, and it's getting worse, and you don't want to be on hormones, and you don't want to have surgery, what can be done? I've always said food can be medicine or food can be poison, right? So the thing that we want to do is eliminate inflammation, because if we can get those tissues just to calm down and not be inflammatory, as just one thing. So I'm just focusing on diet to decrease the inflammation. It's not a cure-all. I'm not going to remove it, but it's going to help with that. So you want to eliminate inflammation. So dairy products are very inflammatory. refined sugars, caffeine, carbohydrates, the wheat, the gluten, alcohol, soy, foods that have high estrogen, because the more estrogen you're going to develop that lining and the thickening. Food, some things that you don't think about. Why do the grains have it? Is because there's a fungi that's colonized on it, on the corn, the barley, the wheat, other grains that cause increased estrogen, like and the additives. Some of the additives that they add that prevents discoloration and increase the shelf life of shrimp. So a shellfish has an estrogenic effect, so you would want to avoid that. And another common propylgallate, which is a common preservative that acts like an estrogen that they use in fats and oils so preventing them from becoming rancid in vegetable oils and meat products. Sometimes even on the protein on the sticks, because the potatoes. So the potatoes, they don't want that oil. They don't want to go rancid. They have it in chicken stock too, chicken soups, bases, sometimes in chewing gums. Estrogen is higher found in conventional meats and conventional dairy. So you want organic grass-fed beef, organic dairy, and also more estrogen in beer, wine and bourbon, of all things. PBA also, so bottled water, you don't want to drink out of plastic bottled water. The phthalates, the synthetic, those senses that's in makeups, vinyl shower curtains, sometimes in laundry detergents, you want to be careful about that. Polishes, plastic clean wrap. And then certain oils, sage, geranium, olive oil, tea oil. You just want to be careful. You don't want to get too much of the estrogen. And so if you know you have fibroids, you're having high estrogen, you're estrogen dominant, you're having increased pain, maybe you have endometriosis, you just want to reduce the amount of estrogen, external estrogen that you're getting, and the amount of inflammation that you're getting. So what reduces inflammation is vegetables. So typical women who has endometriosis, they don't eat much vegetables. They're low on omega-3s, and they eat more red meat, coffee, trans fats, those types of things. So you want anti-inflammatory foods. So that's leafy greens. It's all those whole things that you just go to the produce section. If you just eat out of the produce section, you're going to be good, right? So you have leafy greens, you got celery, you got beets, you got broccoli, blueberries, pineapple, walnuts. You're going to have chia seeds, flax seeds, but salmon is good. Bone broth also is walnuts, coconut oil. Those are anti-inflammatory. Magnesium. I always say you can't get enough magnesium. Magnesium helps you to relax, helps you to sleep, helps with sore muscles. And so you want food rich in magnesium, and it helps with smooth muscle of the uterus to reduce pain. So that's pumpkin seeds, sunflower seeds, black beans, avocados, almonds, bananas, charged spinach. Also, if you have endometriosis and you're losing more blood and just bleeding, have that intermittent bleeding and bleeding more, you want iron-rich foods, right? So lots of maybe some liver, if you're not vegan, liver, beef steak, navy beans, black beans, spinach, egg yolks, prunes, artichokes, collard greens. Also, omega-3. Omega-3 is anti-inflammatory. So I'm always harping on people to get their omega-3 index elevated up to an 8 because it's cardiovascular protective, and it just decreases inflammation all around. So flaxseed, chia seeds, almonds, walnuts, trout, tuna, sardines, anchovies, mackerels. These reduce inflammation, relieve joint pains and muscle pains, and it just even regulates your hormone production. So even regulating your hormone production, when you regulate that, can reduce the endometriosis, because basically that's what we're doing in conventional medicine. We're giving you hormones to reduce the amount of stimulation to that tissue that's in the outside, so that maybe they'll shrink away and kind of disappear, right? So So constipation is common in endometriosis, so you need more fiber, high fiber. So you may want to take quinoa, vegetables, brown rice, and if you're taking rice, you want to always cool them, completely cool them, and then reheat them up, because once you've cooled it, then it changes into a resistant starch. I mean, resistant fiber. So it's an insoluble fiber and then not a starch, right? So berries, these are for constipation. Berries, coconut, figs, artichokes, peas, okra, Brussels sprouts, turnip, acorn squash, all good fibers to help you not be as constipated. And then some of the supplements that I like, sometimes I prescribe you want to have progesterone. So that helps balance out the estrogen if you're more estrogen dominant and you're not have enough progesterone. So we may add a bioidentical progesterone, fish oils, milk thistle, cycloglenoid, which is a pine bark extract. And this really good is a hormone alternative. B vitamins. You can't get enough of the B vitamins. Those are your go-to, balance your hormone, and just helps with all cellular activity, because it's needed in cellular function. So you need at least 50 milligrams of the B complex. But a lot of times I will test to see where you are and give you a compounded and get it specifically to what you need. And it helps you reduce toxicity. And BCAAs is a mood booster, increases energy. So can't speak enough about B vitamins. And I really like compounding them specifically. So it's very personalized to what you need. Acupuncture, very good. So I talk about energy as one of the 4 treatment areas that we need: structural, working on the body, chemical, herbs, supplements, botanicals, drugs if you want, energy. And acupuncture is energy work, because you want your meridian and your chi actually flowing, right? So 4 weeks of it treatments may actually reduce pain. Essential oils can boost your immune, reduce pain and inflammation. Sage would be good. Clary sage is a good one to balance the hormones. And then, as I said, in conventional medicine, they're using hormones like Lupron, other injectable progesterones, and synthetic steroids, and surgical and hysterectomy. So, so just try to be anti-inflammatory, and pretty much this for everything, right? So if you can just stay on an anti-inflammatory diet, you pretty much can heal yourself. You may also, the more fiber that you get, you may actually heal that gut inside and feel better. So for those suffering with endometriosis, I wish you less pain and feeling better. And hopefully this tip will help you. So if you find this information helpful, like it, share it, pass it on. Please let me know what you're interested in hearing about. And I would love to share with you what information you need. Consult your doctor always. And I'm always happy to collaborate and work with your primary care physician. So, because I am your subspecialist to wellness and to health, looking at more as a proactive than reactive medicine. And if you need to reach out to me, go to my website, ANITAWANGMD.com, or 949-734-0580. And you can leave me a very detailed message and I'll get back to you. You can always schedule a complimentary discovery call with me, and we can discuss your issues and see if I can help you. And until then, till next time, be safe and be well.